Hello, my name is Carl. I'm a paediatric emergency medicine doctor. Today, we are going to continue talking about acute behavioural disturbance and focus on how you can learn from structured debrief. Why debrief? The quantity and quality of research articles supporting debrief continues to grow. This literature includes focused outcomes such as decreased rates of patient behavioural events following the introduction of a debrief tool. Whilst more research is needed, positive impacts can be expected if personnel are properly trained and providers adhere to the accepted debrief standards. These benefits include facilitated learning, both technical and non-technical, improved team working and cohesion, emotional support, and effective coping with less moral distress. Lastly, these all come together to impact patient outcomes, including improved patient safety. In short, debrief matters. So following the de-escalation of an angry, agitated, even violent young person, who can debrief? Anyone can debrief. It need not be the most senior clinician. It need not even be a clinical member of staff. Provided they have had some training in debrief, then they are more than suitable. Firstly, set aside some time, ideally whilst events are still fresh in people's minds. Secondly, choose a facilitator to lead. Third, create a safe space. And then lastly, ensure that you check in with everyone there, listen to them, validate when possible, and avoid any judgment. One helpful aid memoir to provide structure to your debrief is as follows. Talk and take stock. T. Have a target and clear goal. A. Analyze what helped and what hindered that goal. L. Learn from events, summarize. And K. Ensure key actions are allocated going forward. Good practice includes taking stock. Take and utilize a debrief tool. Ask if everyone is okay. Know or find out if anyone needs a break. Inquire and enable engagement rather than talk at your team. S. Summarize events. Think about what went well. Consider opportunities for improvement and consider if a cold debrief is needed later. Always know and record who was present in the debrief. Post-incident debriefing is more than just learning. It is also about post-incident support. It's important to know that poor post-incident debriefing can be harmful. The facilitator should be skilled. It should not occur during acute distress, and sometimes a cool down period after the event may be required. There should be a clear debrief policy. Without this, people can be left feeling exposed, accused, or even blamed. So what is good post-incident support? To bring this back to the context of acute behavioural disturbance, we will talk as if an episode of physical restraint has just been discontinued and consider the needs of both staff and the young person involved. Many of the following strategies apply both to the young person and also to your staff. Avoid overloading them further. Get on a level and don't be hierarchical. Emphasize that they are not in trouble and that you're speaking cooperatively to find solutions. Keep verbal and non-verbal language supportive and simple. Listen sensitively in an empowering way. Acknowledge feelings and emotions that must have been frightening for you. Respect their needs. Allow them to direct their own process and recovery. Check in now and again, making sure meanings are understood. Remember, the person in front of you, be them a young person, a child who's just been restrained, or a member of staff who's done the restraint, they need to feel safe and secure now. The goal is to help them activate their own learning and recovery. If you would like to read more about this, consider the mnemonic support shown below and pause the video now. If any of the challenges described in these videos have caused upset or affected you, I hope to add links to support resources in the description soon. Always remember local systems where you work are available, and take care of yourselves to take care of others. Basics matter. Sleep, drink, eat, and take breaks. Thanks for listening to this series. I hope next time to discuss further verbal de-escalation techniques, sedation and restraint. Thank you.